Hello, my name is Kiana Thomas, and I will be presenting to you the Biopsychosocial review of smoking. So, what is smoking? Smoking is defined as an inhalation and exhalation of fumes such as cigarettes and nicotine. One of the world's leading causes of preventable death in the United States is smoking. So there are so many people in the world today that smokes, and research states that 1 out of 5 individuals are killed due to smoking. Smoking causes over 5 million deaths per year. Yes, that is a lot of people. Research also shows that men smoke more than women. So later on in the presentation, we will take a look at that. So, the fun facts. Did you know that smoking is addictive more than any other drug? So, did you know that it makes your breath, clothes, and hair smell bad? So, being around someone you can smell when you're walking in their house and they've been smoking. You can smell the smoke in their clothes. You can smell the smoke on their hair, on their skin, in their breath. Also, did you know that smoking turns your teeth and fingers yellow? And did you know that smoking is the most cause of lung, throat, and mouth cancer? Those are really fun facts to know. Now on to the statistics. So there are more than 20% of all adults that smoke cigarettes. So that's a little under half, but still, that's a lot of people who smoke cigarettes. Smoking is also more common among men than women, as previously stated. Also, the smoking rate remains high across the world today. 1 out of 5 Americans' death is due to smoking. So, that is an estimated amount of people that smoke is 46 million people, which is about 20%, and they are at least 18 years or older. One cigarette smoking is more common among men, which is 23.5%, than women, which is 17.9%. One cigarette smoking is the leading cause of preventable death in the United States, two accounting for approximately 443,000 deaths, or 1 of every 5 deaths in the United States each year. Wow. Now, let's take a look at smoking on the map. So right here, you will find a map of states that have the least amount of smoking, the most amount of smoking, and mild smoking. So the leading states that smokes the most is Arkansas, is Kentucky, and West Virginia. Well, these states are the leading states that smokes the most. Well, the least states are California and Utah. So, the leading states may smoke the most because of their population and because due to the non-ban of smoking. The least states, which is California and Utah, have been banned from smoking in certain areas. So that's why it is the least amount of smoking in those states. Now let's talk about the biopsychosocial model. The biopsychosocial model studies the interaction between these 3 factors to understand health and illness, such as smoking. So smoking is a complex phenomenon and behavior pattern involving 3 factors. So those 3 factors are biological, psychological, and social. Now let's look at the biopsychosocial model. So the biological part of the model focuses on the physical addiction. So someone being addicted to smoking, the withdrawal symptoms, the use, which means it causes relief, and also the reward that comes with smoking. So how people feel after after they have smoked. The psychological part comes with paired activities, routines, and habits. So therefore, it's a habit for people. Triggers. So if anything triggers them, as in stress or any emotion that allows them to smoke. Also stress management. So if someone is stressed out, most likely they will go and smoke cigarettes. They will go drive to the store and they will buy cigarettes and smoke it so it can relieve their stress. And also it helps with coping with emotions. So a lot of people do smoke to help cope with emotions, such as if they're sad or if they're depressed or they're not having a good day. Smoking helps them. And we have the social part of the biopsychosocial model, which means the connections, who you're connected with, the fitting in. Maybe adults or young adults have people want to show people that they can fit in with them, or the family/partners. Maybe their partner, their spouse, or their family smokes, and even the cultural norms. So we know that there are some cultures that do allow smoking, that individuals are brought up because of smoking. Now off to the biological factors. So we have 3 main biological factors, which is the hereditary genetic, and that means the nicotine addiction. We have the gender, which means men tend to smoke cigarettes more than women, and the physiological addiction. So the nicotine is a highly addictive substance. A habitual smoker will experience withdrawal symptoms if the level of nicotine is not constant in the body. This could explain why most smokers in the United States who would like to quit cannot. So nicotine is very, very, very addictive, and it is very hard for an individual to stop smoking and to relieve the nicotine addiction. Now let's move on to the psychosocial factors. Alright, the psychosocial factors associated with smoking in ethnic groups includes availability of tobacco products and the role of family and friends, and also the culture, like stated previously. So, a number of factors influence the use of tobacco by individuals. Some of these are the family history of smoking. So therefore, if they were raised up in a household when their parents were always smoking, or their grandparents, it can be a lifelong tradition that smoking is in their family. Also peer influence, experimentation, easy access to several products, personality factors, the aggressive marketing strategies of the tobacco industry, and more. So these are definitely the psychosocial factors that help influence smoking, that helps keep smoking going. Also peer influence. Some individuals just want to fit in, and some may be peer pressure, and there are people that say, come on, let's try it, you can do it. It won't hurt. It'll make you feel better. And that's why some individuals do start smoking. Now, let's move on to the psychological factors. There are different psychological factors such as depression, when someone feels isolated, when someone feels stressed or euphoria. I mean, depression. All of these emotions running through somebody's head helps them. Smoking helps them relieve these emotions. Now let's move on to the social factors. So what are social factors that cause smoking? There are plenty of them. Like previously stated, the socio-economic status, peer pressure, modeling, and family members. So, since human behavior does not take place in a vacuum, social influences like modeling, peer pressure, and family members who smoke are also part of the whole picture. The social perspective is as much important as the other two approaches are because assessment and treatment may not work if that factor is left behind. Persuasive tobacco company tries to convince individuals to start smoking, and friends and family members can offer or force an individual to smoke. Now let's look on at the effects of smoking. Different effects are stroke, coronary heart disease, lung disease, asthma, certain forms of cancer like lung cancer, mouth cancer, bone cancer, and stillbirth/low birth weight. Now, smoking has some emotional effects in individuals, such as being energized, pleasure, weary, pleasure, and satisfaction. The emotional effects of smoking make it difficult for smokers to quit and non-smokers to understand. Both non-smokers and smokers experience emotional reactions to cigarette smoke and nicotine. Not surprisingly, those emotional reactions are quite different. So what are the treatments of smoking? The treatments of smoking depends on the severity and the cause of the condition. Possible treatments include cognitive behavioral therapy, motivational interviewing, mindfulness, telephone support, and quick lines. So, the cognitive behavioral therapy. Cognitive behavioral therapy helps individuals identify triggers. So, CBT helps patients identify triggers, the people and places and things that spur behavior, and teaches them relapse prevention skills and effective coping strategies to avoid smoking in the face of stressful situations and triggers. Study shows that patients who participated in 6 intense sessions had better quick outcomes. So those who stayed the whole 6 sessions had a better outcome for quitting smoking. And like previously stated, CBT helped patients come up with coping strategies. Now, the motivational interviewing. Motivational interviewing is defined as a directive, patient-centered counseling style for eliciting behavior. It helps decrease smoking, and you have learnable and specific interventions. Motivational interviewing is one of many useful interventions. So we start from right here when they just start smoking. Then they decide to try to stop smoking. Then they try stopping, and either they can stop and stay stopped, or they may relapse and start smoking again and start the cycle over. Mindfulness helps with managing withdrawals from smoking. Mindfulness can also help manage nicotine cravings, reduce stress, anxiety, and depression, increase positive emotions, encourage healthier eating habits, and improve relationships. Now, the most important is the telephone support and quit lines. These interventions have proven effective in helping users to quit smoking. The program provides individuals with counseling, medication, self-help materials, and referrals. So if anyone wants to quit smoking, all they have to do is call the quit line at 877-448-7848. And that is my presentation.